No, it's not. It's not, really, it's not. I think it's both morally bankrupt and it's also medically very inept because it really won't help. It will drive health inequalities. At the moment, we have a really big gap between the health of those with money and those without. If we start charging people to seek help, that's only going to get worse.
Won't it reduce unnecessary visits?
No, I really don't think it will. Partly, people don't know what's necessary or unnecessary. They come to the doctor because they think they need to see the doctor. Now, it might reduce necessary visits from people who are most at risk. You know, if you're living on the margins, you may decide, actually, you're going to ignore this bleeding from your bottom for another week or another 2 weeks or 3 weeks until you've got some spare cash to go and see a doctor about it. And it's going to make the difference between people coming with illnesses that can be treated at an early stage and people coming when it's too late.
Yeah, but now we ignore, sorry to interrupt, but now we ignore those things because we are concerned we're not going to be able to see a doctor, or you ring up and they say there aren't any appointments. So we're sort of doing that at the moment because the NHS is in crisis.
The NHS is in crisis. What this would do would make it so that it was okay for people who have money and not okay for people who don't. And when the NHS was founded, there's a quote that's attributed to Bevan, which is, illness is neither an indulgence for which people have to pay, nor an offence for which they should be penalised, but a misfortune, the cost of which should be borne by the whole community. That's what we do. We pay our taxes so that everybody can get the healthcare that they need when they need it. Now, it's possible that not enough of that money is being allocated to the health service. And I absolutely agree that the standard of care we've got at the moment is not good enough and the standard of access is not good enough. But you're not going to improve it by saying, okay, let's just give it to the rich people.
But it worked in terms of prescriptions, didn't it? And also dentists. You know, we pay for prescriptions now if we can afford it. If you know, people pay to get dental care. There was a big uproar at the time, wasn't there, about that? And now
and if you look at dentistry now, you will find that the teeth of the poorest part of our community are very, very poor. There's a huge amount of do-it-yourself dentistry. People taking out their own teeth because they can't afford to go to a dentist. And NHS dentistry has almost completely died. Now, if we'd like the rest of the health service to go the same way as dentistry, this is the way to go. But it's not a good way. It's not a good way for our health, and it's not a good way to improve Britain. Because do we want a divided society where if you're rich you can have healthcare and if you're poor you can't?
But does it work like that? Wouldn't it work whereby if you can afford to pay, you pay. If you can't afford to pay, you don't pay. But everyone gets the same service because we're relieving some of the pressure by those who can afford it paying.
I'm really sorry, we cut out there, so I missed what you just said.
Okay, well, let me just give you an example. So seeing a GP in Norway or Sweden costs £20. So you get seen when you want to see and you pay the doctor. If you can't afford it, you don't pay, but you get the same service.
Yeah, and that's a really interesting question. I mean, the question is who decides whether you can or you can't afford to pay? Because at the moment we have lots of things that are means tested. For example, prescriptions. And there are plenty of patients who don't pick up their prescriptions. They don't quite fall into that category where they get them free because their income's not quite low enough for that. But they're still really struggling. And since the recent cost of living crisis, even more struggling. So people, you know, will decide just not to have their inhaler because they can't afford that and the weekly shot.
Saiid Javid said we need to have a grown-up, hard-headed conversation about revamping the NHS. I think everyone agrees that the NHS in its current form isn't working. What's your solution?
Right. Well, what we really need is a bit of sensible, grown-up workforce planning. Okay, because we're losing doctors and we're losing nurses really quickly, and that's why you can't get an appointment. It's because there isn't enough going in and there isn't enough planning going in to keep doctors and nurses there. Junior doctors, nurses, they're leaving their professions, they're going abroad or they're going into other sectors largely because of pay, also because of working conditions. Now, if you actually got that bit right, if you thought about how many people you needed to train, if you thought about what you need to do to keep those people in their jobs once they're there, then we could start reforming the NHS and making it work, but actually deciding that you're going to get people to pay to go individually to go to the doctor rather than we all pay for it equally and share that load. I don't see that that's a way forward or a way of helping.
Yeah, it's a debate that's going to carry on, isn't it, over coming weeks, months, and potentially years as well. But we must leave it there for the moment. Dr. Helen Salisbury, thank you.
Thank you.